So you're big on sedation dentistry. Like, who's the typical patient?
One patient would be a phobic patient. They're scared to even come through the door. I had one man the other day, he was pacing back and forth in my lobby because he was so nervous to get into the chair. So you have that patient, they can have sedation and be asleep and not even remember the procedure.
Okay.
Then the other patient would be someone who they're busy, they're a working person, they need to have a lot done in one day. So we try and do all their work in one visit, and they're sedated for that. They're asleep for the appointment, so they don't have to hold their mouth open as long. They're not worried about the appointment because they know that that one visit will take care of everything.
So when you say you could take like 6 months worth of dentistry in one visit, it's because you could spend more time because they're sedated.
Exactly.
Is that right?
We can do better dentistry because some people, they become a little uncooperative when they see all of the different things in a dental office. But if they're asleep, they're rested, we're able to do everything in one visit, and that way we can do months worth of dentistry in one day. And we do a better job that way.
You like sedation? I mean, it must be easier on the doctor.
It's easier on the doctor, it's easier on the patient, exactly. Because nobody wants somebody standing over them, pulling back and forth on their head, trying to take out a tooth or holding their mouth open for hours. So they would rather come in, be put to sleep, get the job done, and then leave.
Now, I've had dentists on this program. They say, Randy, with good bedside manner, you don't need sedation. Do you think that's insensitive? Because, look, I told you, I like the nitrous, just even for a cleaning. And I'm not afraid of the dentist at all, but it's like a spa day.
Some people haven't had to have a lot of major dental work done. And if you haven't had to have a lot done, then sure, you might say, you don't need to be asleep for it, it's easy. But most of my patients, they need a full smile makeover. They need work done to almost every
tooth. Because you do a lot of dental
tooth.
implants, things like that.
Yes, and especially for surgeries. I wouldn't want anybody working on me if I wasn't asleep.
Okay, and you like to use like an anesthesiologist or nurse anesthetist?
Yes, we actually have an anesthesiologist who they know how to keep a patient safe during sedation. Some people are afraid to be put to sleep, but the anesthesiologist does a great job of making sure that they're monitoring everything, they're monitoring their vitals, and then I'm able to do the best of what I do, which is to correct their smile.